Hello everyone, we are from Small Group Discussion B5. Today we will present it about our student project. The title of our student project is Diagnosis and Treatment of Sea Urchins. This is the overview of our student project. Okay, but first let me introduce myself. My name is Ana Agung Istrianglini with my last 3-digit ID student number is 233. Okay, so the background of this our student project is Indonesia's its rich biodiversity includes the Echinodermata phylum, which contains sea urchins. Sea urchins have a hard shell and are coated with black pigment. The body of the sea urchins is also dominated by spines, which are very fragile and have high toxicity. These spines are used to protect themselves, or what is known as therium. If human accidentally step on this, the thorns will cause puncture wounds, which allow bacteria and other germs to enter. Puncture wound resulting from injuries caused by sea urchins will be painful and cause severe muscle pains that last up to 24 hours, bleeding and swelling of the legs. Based on that matter, our group discussion is interested to make a student project with the topic of diagnosis and treatment of sea urchins. That's all that I can say, and for the next explanation will be explained by my friend. Thank you.
My name is Rani Parawita with last three digit student ID number is 236. So today I will explain about the problem formulation. The first one is what is the definition and etiology of sea urchins. The second one is what is the epidemiology of sea urchins. The third one is what is the pathophysiology of sea urchin stings. The fourth one is how is the clinical presentation of sea urchin stings. The fifth one is how to diagnose sea urchin stings. The sixth one is what is the treatment of sea urchin stings. The seventh one is what is the complication and prevention of sea urchin stings. So the second one is objective of the study. The first one is to understand the definition and etiology of sea urchins. The second one is to understand the epidemiology of sea urchins. The third one is to understand the pathophysiology of sea urchin stings. The fourth one is to understand the clinical presentation of sea urchin stings. The fifth one is to understand how to diagnose sea urchin stings. The sixth one is to understand the treatment of sea urchin stings. And this last one is to understand the complication and prevention of sea urchin stings. The last one is the benefits of the study. So this student project provide numerous benefits for medical students in understanding the definition, etiology, epidemiology of sea urchins. In addition, this student project also assist in understanding the pathophysiology, diagnosis, treatment, prognosis, and complication of sea urchin stings. The benefits of this study for the community is to increase understanding of sea urchins and to increase awareness about the disease.
Thank you for the time. My name is Sabrina Putri Donita with 3-digit last student ID number 198. On this occasion, I will to present about definition and etiology sea urchin. Sea urchin are member of the Echinodermata group that inhabit marine water throughout the world. The sea urchin body is round and covered with spines as a means of protection and locomotion. Sea urchins are herbivore animals that are various marine plants such as algae and microscopic organisms in the sea. They are also found out of on the coast and coral in shallow waters. Sea urchins sting cause pain, redness, swelling, bleeding, and wounds. Complications from sting can include granulomas, neuropathy, arthropathy, and bone damage. Sea urchins reproduce sexually and asexually. They have an important role in marine ecosystem, controlling marine algae population and being a food source for various marine animals. Knowledge the sea urchin is important for understanding marine ecology and conservation of marine resources. Thank you.
Hello, my name is Kedari Devadanjaya with the last three digits of my student ID is 075, and now I will explain about the epidemiology of sea urchin related injuries. Sea urchin stings can also be classified as echinoderm inflammation by knowing that this species is included in the echinoderm phylum. Globally, cases of echinoderm inflammation do not represent a significant public health problem, and the epidemiological data are also limited. Inflammation incidents are mostly reported on tropical and subtropical coasts, especially those with shallow water and rich coral rocks. According to the American Association of Poison Control Centers, the estimated cases of sea urchin inflammation reach about 1,800 cases each year.
Good day everyone, my name is Sheila Monica with the last digit of my student number are 2, 2, and 8. So let's move on to the pathophysiology of sea urchin injury. So first, when the sea urchin spine physically punctures the skin, it is resulting in the initial injury and then trigger a foreign body reaction. This wound can cause an inflammatory reaction from the release of inflammatory mediator, such as prostaglandin and histamine, that can produce localized pain or intense pain, swelling, and redness at the site of the injury. And then later, gradually the body may form granuloma that helps in the foreign material isolation. And secondly, Sherchin has toxic chemical in its epithelium. The toxic chemicals such as steroid, histamine, serotonin, cholinergic agents, glycoside, and compounds similar to bradykinin. The inflammation frequently results in cardiac depression, reduced neurotransmission, cellular metabolism, and also mast cell degranulation. And then, secondary infection can also occur from the bacterial or fungal in the marine environment that had been carried by the sea urchin spines. If the skin is penetrated deeply or the wound is not clean enough, there is an increased risk of this secondary infection. And lastly, people may also occasionally develop an allergy to any of the poisons or venom ingredient from the sea urchins. Thank you.
First of all, let me introduce myself. My name is Erika Lewis with three last digit name 089. Now I'm going to present about the acute clinical presentation of sea urchin injuries. Sea urchin injuries are frequently encountered by fishermen, divers, and snorkelers in rocky, shallow marine environments. A searing, instantaneous paralyzing pain will be felt by the patient, limited to the puncture wound. Pressure on the wound will exacerbate the burning sensation that might persist for several hours. Localized pain, bleeding, erythema, edema, myalgia, etching, and transient blue-black staining are all possible symptoms of non-venomous spines. The most well-known is the poisonous flower urchin, or called Toxopneustos pileolus, which is found in the waters of the Indo-Pacific. Its poisons have been known to cause a neuromuscular blockage, resulting in systemic symptoms such as aphonia, fainting, numbness, respiratory difficulty, and perhaps fatality. Maybe that's all from me. Next slide will be presented by my colleague. Thank you.
Okay, my name is Agustin Radina Pratyaksa with the last 30 digits 2012. So I'm going to explain about the delayed clinical presentation of the sea urchin injury. So generally, it consists of the appearance of the granulomatous nodule lesion or the sea urchin granuloma, which is appear 2 until 12 months after the puncture of the sea urchin spines. So this granuloma is usually caused by the Mycobacterium marinum or the inorganic substances found in the sea urchin spines, such as the calcium carbonate, magnesium carbonate, calcium sulfate, phosphate, and the silicon dioxide. So the clinical appearance of this granuloma is firm, reddish or pink in color. There are papules and nodules with a hyperkeratotic surface in the middle. So beside this granuloma, the toxins or the proteins from the sea urchin's spines can also cause the granulomatous or chronic chemical synovitis, neuropathy, sea urchin arthritis, delay hypersensitivity, osteomyelitis, and dactylitis, and rarely can cause the eumycetoma due to the exophyllagen cell fungi. So that's all from me about the delay clinical presentation of this sea urchin injury. Thank you.
Hello doctors and friends, my name is Madinila Nirmala, last digit number is 106, and in this video I will continue the presentation on the diagnosis of sea urchin injury. Clinical sign and history are typically used to make the diagnosis of sea urchin. Epidemiological characteristic and dermoscopic result can further support the diagnosis. Patients who in the past 24 hours have inadvertently stepped on a sea urchin typically experience crushing pain that is localized to the puncture wound, quickly paralyzing, and can linger for many hours. After unintentionally treading on a sea urchin, some people experience no pain. Patients may also report other symptoms such as dyspnea, stomach pain, and breathing difficulties. In more severe cases, there may be vomiting, nausea, paresthesia, muscle paralysis, and respiratory difficulties. Bleeding, edema, erythema, and a warm feeling surrounding the puncture site will be discovered during a physical examination. The presence of dark blue or black pigmentation that has been released from the spine and permeates the patient body parts into the surrounding tissue is one of the common observations. Sea urchin can have spines that are visible or invisible in certain situations. The patient may develop signs and symptoms of synovitis or tenosynovitis if the sea urchin damage affects the small joint in their hands and feet.
Although there are no particular laboratory tasks to identify sea urchin injuries, supporting examinations such as radiography, ultrasonography, CT, or MRI can assist in locating the sea urchin spine and removal. I think that's all from me. The rest will be presented by my friends. Thank you.
Hello all, let me introduce myself. My name is Kalista Moramanduro with the last 3 digit number 208. Now I will explain about the first aid of sea urchin. For the immediate post-injury steps, the first one is to remove the pedicellariae, then extract the spines, and immerse the affected area in hot water for 30 to 90 minutes. For additional consideration, remove the pedicellariae with shaving cream and a razor. For spine extraction, consider using hot candle wax. In some cases, remove the epidermal keratin and apply salicylic acid paste. Avoid squeezing spine through the skin. Do not crush spine with the intention of rapid resorption. If severe systemic symptoms appear, transfer the patient to hospital for respiratory support. For identification and species, ensure the source of injury is indeed a sea urchin, as not all species are toxic. If the source is unclear, consider treatments for other marine envenomations. That's all from me. Thank you.
My name is Iputu Dharmagita with last three digit number 083. Definitive management. For the earlier presentation, we should use X-ray and USG if there are clinical suspicion of retained spine near deep. If there are no superficial M spine or no spine near tendon and joint, we should use hypodermic needle extraction and punch biopsy if there are few spine. We should use area laser and liquid nitrogen if there are numerous spine. If there are deeply tapped spine or spine near tendon and joint, we advise surgical consultation as soon as possible for this patient, ideally with subspecialists in the affected anatomical region. For the delayed presentation, we should use MRI and USG if there are clinical suspicion of retained spine near deep. For the delayed presentation, we advise surgical consultation as soon as possible for this patient, ideally with subspecialists in the affected anatomical region. If the acute delayed presentation has a clinical sign of tenosynovitis, we advise urgent surgical consultation such as debridement of granulation tissue and early stenosynovectomy or synovectomy.
My name is Gustin Rahgun Rajawansa with my last digit number is 144. Now I will explain about complication of sea urchin stings. Sea urchin sting can lead to a variety of dangerous problems if left untreated. Possible sea urchin sting complications are paralysis, respiratory failure, tissue necrosis, and death. Any spines that are broken off within the body may get deeper if not removed, causing tissue, bone, or nerve damage. This might result in tissue death, joint stiffness, or arthritis. Aside of that, if the sting of a sea urchin is poisonous, symptoms may include radiating pain, numbness, hypotension, deafness, dyspnea, and even death. If necrosis or tissue death occurs, a person needs to see a doctor. In rare circumstances, shortness of breath or respiratory failure might occur. This needs rapid emergency care, including oxygen supplementation and maybe ventilation. That's all from me. Thank you.
First, let me introduce myself. My name is Febiano Di Prawira. I'm the last digit of my student number 156. Now I'm going to explain about the prevention of sea urchin envenomation. Sea urchin envenomation is primarily caused by the puncture of sea urchin spine, which usually occurs when someone is walking or swimming in a large body of water. The best prevention is to be more vigilant and aware of the surrounding environment to avoid getting punctured by the sea urchin spine. Some other ways to avoid the puncture of sea urchin spine is to avoid walking barefoot and to wear proper diving equipment and shoes. It is important to note by wearing proper diving equipment and shoes gives minimal protection, but it can be easily penetrated by a sharp sea urchin spine. That's all from me, thank you.
Hello everyone, my name is Luis Felix Juanda with the last digit of my student number 117. Now, the summary. We now know that most sea urchin stings are not venomous, but venomous stings can cause more serious systemic complications like hypotension, respiratory failure, and paresthesia, and etc. The next thing to be noted is diagnosis is made clinically. We must have a history of marine environment activity and possibly some sea urchin contact. Treatments include removing the pedicellariae, extracting the spine, and immersing the affected area in hot water. For prophylaxis, we can give antibiotics and tetanus booster. And then the next thing to be noted is untreated stings, either that is non-venomous or venomous stings that can cause paralysis, respiratory failure, necrosis, and even death when left untreated. Okay, that's all. Thank you for listening our presentations.